Okay. Cool.
And I'm like, we did the song for like 3 weeks, and like and it was like, God, I feel like not hard, but it's like it's overwhelming for like that's like it's over for like a 7-year master's student. It's like pretty good. Yeah, in that beat and the like I can't imagine every couple.
My crazy COVID hair, like showing that it's really good.
I don't know.
Yeah, I have
COVID hair. I have COVID hair.
Yeah, I have too.
So a year ago, during COVID, for 6 months, or like at least 3 or 4 months, my hair was falling out. Like pregnancy. Yeah. And it would fall out in clumps at the bottom of the camera. And then I would, it all
thank
started
you.
back, but now
I was like, I have to do this, like this is my life.
Back in the
That's all like.
Considering having a baby in the future, and so anytime anything about pregnancy.
I know.
No. How about your slide? Looks great.
Thank you.
Nice to have visitors. Thanks for joining us. Hi, how are you? Good. Is it every time?
Yeah, almost. Yeah, 12:04.
It's 12:04.
Yeah.
Okay. Great. It's great to see everybody who's here. I know some more people will be trickling in. Do we have the recording on and people have joined us?
Yes.
Okay, great. Oh, I do see lots of participants there. So thanks for joining us today. It is my extreme pleasure to introduce Abhilasha Shrestha. Did I say that right? Yeah. Who is a researcher, research faculty here in the division. And she, many of you don't see her because she's often working very hard in the lab and doing a ton of amazing work on water quality. And so I'm just going to let her describe her work and her research, and I hope you all enjoy. Also, A+ for your time.
Thank you. Good afternoon, everyone. Thank you for coming. It's kind of a crappy, I don't know how to do that. Yeah, it's like,
you keep talking
like,
and I'll get it. That's part taken care of.
Thank you.
There we go.
Thank you. Thank you. Thanks, Kristen. Again, good afternoon, everyone. Thank you for coming. On such a crappy day. I know it was like, I didn't want to come today. I was like, I wish I could do it by Zoom, but and thank you everyone online. I can't see you, but thank you for joining in. So the title of my presentation is Becoming Uncultured, Using Molecular Method for Public Health Related Water Quality Monitoring. And today I will be providing a brief summary of some of the water quality projects that we have been conducting at EOHS. Let's see. Slide. Next slide. Okay, there. So for those who don't know me, again, my name is Abhilasha Shrestha, and I'm a research assistant professor here at EOHS. I'm not new to UIC. I joined UIC back in 2011 for my graduate degree. So I completed my MPH from UIC School of Public Health in 2013, focusing on environmental and occupational health sciences with a concentration in water quality and health. And then stayed on to get my PhD in May 2019, and then started as a research faculty here January 2020, right before COVID started. So yay. So I conduct research primarily focused on water quality and health. Like I said, my research interest includes studying of the use of different indicators, targets, and genes for rapidly evaluating infectious agents in water. mostly surface water. I do a little bit of wastewater now as well. So I operate and manage the UIC School of Public Health Water Microbiology Research Lab located in SPHW building that we share with IDPH laboratories. Show of hand, who knows where this building is? Not many, okay. So it's about 5 blocks west from here. It's the last UIC building, apparently. The furthest west. It is the last one. You know what I mean. We do have a different water quality and health research happening at EOHS in that lab. I mainly do the biggest project that we do every year is the Chicago Beach Water Monitoring Program, where we test beach water from public Lake Michigan beaches in Chicago every day. We've been doing that since 2015. We just completed our 8th year doing that earlier this month. We do it starting Memorial Day until Labor Day, and results from the test are reported to the Park District and the general public within 4 hours of sample receipt. Another project that we do is microbial source tracking. So that includes identifying different sources of fecal pollution in water. So we detect and quantify fecal contamination from various different sources like human, birds, dogs, etc. And we've been doing source tracking projects in Chicago beaches. We also do it in global health projects like in Kenya and in Nepal. And finally, one of the projects that I was involved in was the wastewater-based surveillance of COVID. So we monitored wastewater for genetic signals of SARS-CoV-2 to seek an understanding of the presence and scale of infection in a community. So locally, we started that project for Chicago and Illinois, and then we continued a global health project in Kisumu, Kenya. So today I'll try to focus on 2 projects, the Chicago Beach Water Monitoring Project and the Wastewater-Based Surveillance Project in Kenya. Hopefully I'll have time. I don't have, okay, I can see the time. Okay, so the first project that I'm going to talk about is the Chicago Park District Beach Water Testing Project. So just to give you a little bit of background on recreational waterborne illness is a significant public health problem. A recent study, actually, it came from UIC School of Public Health, EOHS, one of Sam Dorovich's first PhD student. She published that recreational water quality activities such as boating, swimming, fishing account for more than 90 million illnesses per year. In the United States alone, and with an estimated annual cost of about $2.9 billion. So that's a lot of money to be devoted to recreational water illness. And in the United States, under the provisions of the Clean Water Act, the prevention of recreational waterborne illnesses centers around water quality monitoring at beaches, followed by public notification of elevated levels of fecal indicator bacteria in beach water. So local and state environmental agencies in the US routinely monitor beach water quality and have done so for decades by measuring E. coli and enterococci. These bacteria often referred to as fecal indicator bacteria. So these fecal indicator bacteria are not pathogenic themselves, but they may indicate the presence of pathogens, fecal contaminations, or health risk in recreational water. So the US EPA issued a national recommendation for monitoring recreational water quality back in 2012, so more than a decade ago. However, despite the widespread implementation of general fecal indicator bacteria monitoring at beaches, this approach suffers from several limitations. So historically, beach managers across the United States have relied on culture-based method. That's why Becoming Uncultured, that was my title, for monitoring these fecal indicator bacteria at beaches. So these culture-based methods, although they are inexpensive and easy to use, require about 18 to 24 hours for the results to be available, thus limiting public health protection. And additionally, studies have shown that prior day water quality information is often a poor predictor of current water quality conditions. So this one I just wanted to put in because back in 2012, when US EPA published the recreational water quality criteria, they suggested that states or agencies use this beach action value, or BAV, as a conservative precautionary tool for making beach notification decisions. This was also the first time that US EPA included a rapid testing method that could determine if the water quality is safe within hours of sample collection. And this introduction of this rapid qPCR method was anticipated to provide increased public health protection by facilitating timely notification to swimmers for elevated levels of FIV. So just keep in mind, we use the enterococci qPCR BAV, which is 1,000, which results in an estimated illness of 36 illness per 1,000 swimmers. So anything above that, we would post an advisory. So now a little bit background on Lake Michigan, or beaches in Chicago. Who has swam in Lake Michigan in Chicago? Okay, good. Quite a lot of people. So as we know, Lake Michigan beaches in Chicago, very popular tourist spot. We have around 26 miles of lakeshore that attracts an estimated 20 million visitors every year. This number is underestimated because this is from like 10 years ago. So the number probably is much higher now. And the Chicago Park District has one of the most comprehensive beach monitoring program in the United States. We test water samples from 17 to 20 public beaches every day between Memorial Day and Labor Day. Something to note about Chicago beaches are that they are very unique, as they're like very protected. No wastewater treatment plants that directly discharge near these beaches. So what happens is, like, the treated wastewater flows through the engineered Chicago River system to the Mississippi River, protecting Lake Michigan beaches from urban discharges. So as a result of that, during dry and most wet weather conditions, Chicago beaches should only be impacted by non-point sources of pollution. However, over the years, we have seen that several Chicago beaches often exceed the limit, safe bacterial threshold limit, especially after rain events. So considering that, this is how we started our beach monitoring program. We gradually started the program back from in 2015. So before 2015, Chicago Park District also relied on culture-based method for beach monitoring and public notification. So they would collect samples, they would incubate it, and 18 to 24 hours later, they would let the public know what the water quality was like. However, in the summer of 2015, the Park District enhanced its monitoring program through a pilot program of rapid molecular testing from 5 Chicago beaches 4 days a week. Rapid testing was then expanded to 9 beaches 5 days a week in 2016. And in 2017, they discontinued doing the culture-based, and they did all monitoring using qPCR 7 days a week during the beach season, which starts, again, Memorial Day until Labor Day. And like I mentioned earlier this month, we wrapped up our 8th season of beach water testing. Also, back in 2020, there was no testing because all public beaches were closed due to COVID. So here's a quick overview of what happens. So every day, 1 liter water samples are collected from 2 specific locations at each beaches, approximately 100 yards apart. Samples are then delivered to UIC by 8 a.m. We used a published US EPA method to quantify enterococci DNA using qPCR. So here's a laboratory workflow. So we have several labs. So we have a sample receiving station lab where we receive and filter the samples. Then we do DNA extraction. We take the DNA extract and then we plate them and do quantitative polymerase chain reaction, or qPCR, amplify the DNA and then get the results. And so once we get, after about 4 hours of sample receipts, results are reported to the park district by noon on same day. And after receiving the results, the park district, they update the flags at their beaches, informing the public about the beach water quality that day. Now, for all the people who wrote, like who said that they have swam, who has noticed all these flags at the beaches? No?
I look for them.
Okay.
I know, I also try to go to the beach before noon because I know Abhilasha's team has reported results.
Okay, once more, who has seen it? Okay, only a few people. Who has seen it and knew what it meant? Thank you. Nobody here. Okay, so now you know what it means. So Chicago Park District uses a flag warning system where green flag means swimming is permitted. Yellow, or actually it's orange, which is caution advised, and red where swimming is prohibited. One thing to keep in mind is swimming is never prohibited with high bacterial concentration levels. They never close a beach when the bacterial, it has to be insanely high. So, we have 1,000 CCE as a threshold if it's like 10,000 or more, or 100,000.
Shouldn't it be like swimming is not recommended because they let you swim whenever you want?
Yes, because people get upset when we need to have another discussion about how people get really upset about not letting them swim. Yes.
When you get a text from the city and they said that there's beach hazard commission, is that for water quality and?
No, it's just the weather.
It's within the flags or just water quality?
No, the flags could be both water quality and the beach hazard. Yeah. So, but when you get the text like this morning, yesterday, you probably got a text that there's until 4 p.m. today. It's because of high waves. It's because of the weather condition, not because of the bacterial level. We stopped doing the testing Labor Day weekend, so we don't do testing anymore. So we do our in the summer. Yeah. Yes.
So is it okay to swim if it's a orange or a yellow flag that's up there, even though option?
It's I wouldn't recommend.
Okay.
We have 20 public beaches, and there are some beaches that never have those flags. So I would recommend going to beaches that don't have, or that have green flags, to be safe. So in addition to updating the flags at the beaches, the water quality data for all the beaches are also made publicly available in the Chicago Park District website. And so here you can go to the Park District website and look at which beach conditions, like which beaches are open, which beaches are closed. On this particular day, Montrose Beach had a swim advisory, but there was a swim ban in Calumet, Oak Street, and Ohio, probably because of high waves. So just to summarize, so how did we get here testing like water samples from 20 beaches every day and providing same-day water quality results to the public? That's not a very common practice in the United States or in the world, actually. Chicago was the first city to do it and have been doing it for over 5 years now for all the beaches. So firstly, we have to say, notice that all of this was not done in a single beach season. We transitioned from culture to PCR testing by gradually increasing the number of beaches tested over the years. The entire water team, the water sampling team and the laboratory technician team consist of University of Illinois, especially UIC undergraduate and graduate students. We usually run a 2-week training program for all the technicians before the start of every beach season. And it's also kind of really expensive to conduct this kind of same-day result notification, because as you can see, the total cost for doing PCR testing for 5 years was around 1.3 million, which it comes to per sample cost around $300. But over the years, our turnaround time for results has been 4 hours or less. So since our labs received the samples, and then we've also exceeded or met all the EPA controls requirement for the laboratory data quality. And one of the biggest advantages of having this qPCR lab set up was that we were easily able to adapt from beach monitoring qPCR to COVID-19 wastewater surveillance in Chicago back in 2020 when the pandemic started. since we had everything set up, it was we were able to jump right into monitoring COVID in wastewater in Chicago and in Illinois, and then sharing our results with the public health officials for targeted interventions. Also, we have published a few papers from the project. So it's not just a project that we do every year. We can also do research projects stemming out of the data we get from this project. And I know Dr. Sam Dorovich talked about one of the projects that he's involved in earlier, I think earlier this year, about the AI and machine learning with the data that we have generated over years in Chicago. Before I move on to my next project, I do want to acknowledge everyone involved in the project. The funding for the beach monitoring project is provided by the Chicago Park District. We have several faculty involved, Dr. Sam Dorovich and Dr. Ira Heimler in the project, and also our water research lab team members, without whom, they have to, the water sampling technicians, they have to wake up at the crack of dawn, go sample, get the water samples in the lab by 8, and then we have a research team waiting in the lab to process the samples. I think Nicola is the only one who was involved in the project this year that's here, but we did have around 18 students this year. So all the students are listed from 2015, it was only me as a PhD student who started it, 2016 until 2023. Last year, we also had a student from Mexico, like the Institute of Public Health in Mexico has a program, global health program. He was able to come and work in our lab. This year, we did have 2 students from Urbana-Champaign who worked in the lab as well as collecting samples. So thank you all the students for getting all the work done and working really hard, 102 days continuously. Okay, so now I would like to move on to the wastewater-based surveillance for COVID in Kenya. We did do it in Chicago initially. We began with doing wastewater-based surveillance of COVID in Chicago, but I don't have time to talk about all the projects. So now I'm going to talk about the Global Health Project in Kenya. So just a brief background on wastewater-based surveillance. So it's a concept where wastewater is monitored for genetic signals of SARS-CoV-2 to seek an understanding of the presence and scale of infection in a community. So studies have shown that individuals infected with COVID-19 excrete SARS-CoV-2 RNA in their stool, urine, respiratory secretions, and saliva. So typically, these excreted SARS-CoV-2 RNA is dispersed in the entire wastewater flow and transported to the wastewater treatment plant. So according to the CDC, the SARS-CoV-2 RNA detected in sewage serves as a COVID-19 indicator that is independent of healthcare-seeking behaviors, access to clinical testing, and also can be used as an early indicator for increase in COVID-19 burden in a community. So therefore, trends in the load of SARS-CoV-2 in wastewater reflects COVID-19 trends in the population and can be used as a community monitoring tool, prevalence estimation, and implementation of targeted public health guidelines. So shifting to Kenya, clinical testing and COVID contact tracing for COVID-19 can be logistically challenging and very costly when applied to large populations, especially in low and middle income countries like Kenya. So this unmet need for testing makes it difficult to identify communities with high rates of COVID-19 infections, which would likely benefit from targeted public health interventions such as promotion of social distancing, hand washing, masking, and getting vaccinated. So given that wastewater sampling and analysis for SARS-CoV-2 can provide a passive estimate for COVID-19 prevalence and trends in these communities, such testing may provide useful and actionable tools to the Kisumu, Kenya County Public Health Authorities. So the primary goal of our project was to pilot and evaluate the monitoring of SARS-CoV-2 RNA in wastewater in order to provide estimates of the true burden of COVID-19 in specific communities to the Kisumu County Department of Public Health. So a brief method. So wastewater samples were collected with the help of the wastewater treatment plant authorities. Then they were transported to the lab, to our partner lab and Safe Water and AIDS Project, SWAP, Kenya. And they were then samples were analyzed for SARS-CoV-2 RNA using the Luminultra's qPCR system that is shown in here. So that's the lab. Those are the samples that we are collecting. Can you see? Yep. And that's the analysis being done. So here's a timeline of the event. So we started pretty late. We started in the spring of 2022, where a team of UIC, me and some students with Sam went to SWAP, and we trained them to collect samples and do the laboratory analysis. March 29, 2022 was when we officially began sampling wastewater. And then we had, at that time, Kenya was in the 6th wave of COVID-19. And then we started detecting SARS-CoV RNA in wastewater samples in early May. And then as the case number began to decrease, samples stopped testing positive. And then earlier this year in January, February, monitoring was reduced because of low case numbers. And eventually in March of 2023, we discontinued wastewater surveillance because cases were down and we also ran out of funding to do it. So sampling was done. So wastewater samples were collected at centralized locations, so meaning wastewater treatment plants, and as well as decentralized locations. So wastewaters from hospitals and public toilets in markets and in bus station and train stations. So the centralized samples reflect an urban population with sewered sanitation, which is pretty low in Kisumu. I think only less than 20% people have sewered sanitation, and also those people are like the higher income range people. So, and then decentralized samples from public toilets are thought to provide an information about residents of area without sewer sanitation. And finally, we also collected samples in hospitals, which provided us an opportunity to compare clinically confirmed COVID-19 cases to our wastewater data.
Can you describe a little bit how you collected the sample from the public toilet?
I don't have a picture. I should have it done. Like, I don't have a picture of a public toilet. But what happens is like in Kisumu, they have like these markets and they have these public toilets, like row of toilets, and all the wastewater is like, it flows into a septic tank or a collection. So that's where we would, instead of going to each and every toilet, we wanted like a overall kind of, you know, idea of what the infection was happening, like how much the infection rate was. So we collected it from a septic tank. And we also, they were also, so they, joy of doing science. They were also, yes, but when we did it for Cook County Jail, we would do it from sewers as well. So I would go to Cook County Jail, and they have divisions in Cook County Jail. So I would go to sewers with like bottles and like a rope, and then put it down and take it from there. So
wow.
yes.
Dedication.
Yes. Thank you. So yeah, it is not the prettiest science, but it is what it is. So we had to do that. Yes. Yes. So thank you for your question. So when you do clinical testing, it's like the swab that you're doing, which is like the virus is very concentrated, so you don't need that much DNA or RNA for COVID. But for water samples, because it was a very new thing that came up, we had to actually do a hit and trial and see how much volume, because wastewater samples, especially environmental samples, they are very complex. So even if you wanted to filter more samples, because it would like, we use like filters for when we did it in Chicago, like it would clog the filters, right? So we had to come up with a balance of, okay, like this is the amount of sample that we can easily filter and also be able to get a positive hit for our samples. For Kisumu, I think we only needed a 10 mil sample. We followed a protocol that the Lumen Ultra folks provided, and they only required 10 mil of samples. And we are still able to get detections with that low amount of samples. Okay. Okay, so yeah. So that was that. And so I talked about that. So so where were the samples collected? So between March 2022 to March 2023, we had around 200 samples collected from 36 different sites and analyzed by qPCR at the Safe Water and AIDS Project Water Quality Lab in Kisumu, Kenya. So you can see a breakdown of where the samples were collected. And here's a result summary of where the samples were collected, how many samples were collected at each site, and how many turned positive. So in the wastewater, we collected around wastewater treatment plant, we collected around 41 samples total, and 8 of them were positive. The marketplace toilets. Oh, I was going to tell you about the marketplace toilets. They also have these things called honeysuckers. I don't know, who knows what honeysuckers are? No? So they have these big tanks that come and collect all the sewage, and then they transport it to wastewater treatment plant, and then they put it there, and then it gets treated. So we also tried to collect water samples from these honeysuckers, but it was very complex, and it would inhibit all our results, and all our internal controls failed. So we stopped doing that. Yes.
How long does the RNA degrade eventually? Like, can you no longer detect COVID after a certain amount of time?
Yes. That was so when they started the wastewater surveillance for COVID, there were like so many uncertainties that came up. Like the first one is, can you get infected when you are handling wastewater, right? So eventually they said, no, you can't get, but you still have to process them in BSL-2 lab, all that. Degradation, yes, there is degradation. I don't know how long it takes to completely, there's non-detected, but even after a certain number of days, you could still detect. There have been papers that have been published that says how much COVID is detected even after certain days. So I don't know the exact answer, when it's when can you say that it's non-detected and it's completely degraded. But so these are fragments, RNA fragments. It's not like a whole virus, but so different fragments. Okay. So this figure shows the detection of SARS-CoV-2 in wastewater samples. The first, the one on the right here are the different SARS-CoV-2 waves, that the COVID-19 waves that Kenya had. So we started doing sample collection and processing for wastewater just right before the beginning of the 6th wave, which is pretty small compared to the first. Like the 5th wave was pretty, it would have been great if we had started our project when the 5th wave started. But like I said, the wastewater monitoring system went live in between, between the 5th and the 6th COVID-19 waves. And initially we did not detect COVID in wastewater, but then right before the start of the 6th wave, we detected COVID in wastewater samples. And then once the wave ended, we were no longer able to detect COVID in wastewater. And then again, in the right before the start of the 7th wave, we were able to detect, and then eventually not detect at all because the case numbers went pretty low after like end of January. So here it's just the same figure as before, but broken down into the different places where we had samples. So the first sample detection was in a market public toilet. And then we had a detection in hospital and then wastewater treatment plant and so on. So
Is this sustainable? Are they gonna keep doing it?
no, we already stopped in March of 2023.
Oh.
Yeah, because we ran out of funding and they didn't like the COVID cases went pretty down. Like you can see at the end of January, they were like basically
So now they're-
non-existent. I know, but don't have funding to do it. So we did report the wastewater data to the Great Lakes Advisory Committee that they have there, and they were able to put the data in their COVID-19 dashboard, which was used by public health officials and has helped in projections and doing some statistical modeling in their case. And so this was actually one of the first studies of wastewater-based surveillance in COVID of SARS-CoV-2 in low and middle income countries that evaluated both centralized like wastewater treatment plants and decentralized community-based samples. And our findings suggest that wastewater surveillance could be a valuable tool for monitoring COVID in both Seward and non-Seward locations. And the detection of the viral RNA in the samples from these non-Seward sites support the use of the approach to evaluate the presence of cases in communities in which clinical COVID-19 testing was rare. So this project actually was funded by the UIC School of Public Health Advanced Global Health Seed Fund. So eventually we ran out of funding, so we couldn't continue doing that. And sample collection and laboratory test analysis was conducted by the research team at SWAP in Kisumu, and special thanks to all the members of SWAP. And then it is also a part of the dissertation for one of the PhD students, Bhagya. The analysis, the results that I showed you is part of her paper 1. So special thanks to her. And then Sam Dorovich, who has helped do the communication and everything else with the SWAP team members. Yes.
I was wondering about the results for this particular project were communicated to the public.
Yes. So you see the picture actually, Dr. Samuel Dorovich and the PhD student I was talking about, Bhagya, was in Kenya last month. They were in Kenya, and you see the picture on the left. Oh, come on. Picture on the left. So this is when they reported their findings to the public health officials. And it's also part of the second paper for her dissertation, where like knowing the public perception of wastewater, what they thought. So she did that. She's working on that right now. So yeah, so we did report all the findings to the public health officials there. Yes. Yes, you can. Because in Chicago, they've been doing like when monkeypox came, they started doing monkeypox, RSV, influenza. So they've been doing all of that in Chicago. They still do it in the East Campus. Yeah, it was the project when we started doing in Chicago, it was very small back in 2020, but then it grew so much that because I was doing everything manually with graduate students, even during the pandemic, we would go to the lab every day, get samples, analyze them, but it grew so much that it was not possible to do it manually with students. So they had to do an automation. So we had to shift the lab to the East Campus, where they had all these equipment that could automate the sample processing. So they do hundreds of samples every day. So yeah. And I thought I didn't have time, but I spoke really fast. But here are all the students, and every year after the beach project is done, we do have a picnic up at Foster Beach. Anybody who wants to swim, Foster is the Foster is the cleanest, one of the cleanest beaches in Chicago. So we go there and have a picnic and talk about our summer and how we can improve it for next year and all that great stuff. So sorry I went so fast, but if you have any questions, I would be more than happy to answer.
Whose house are you at? It's 2018.
Sam. Yeah.
What's the, where should we not? What's the word is worth?
I don't think maybe we should stop the recording. Yeah, it is public available, non